Get the camera out. Okay. Good evening, and thank you for attending my presentation on preventative healthcare screenings and exams. Today, I'm encouraging you to participate in preventative healthcare screenings and exams. My main points will be the importance of preventative healthcare, the types of preventing and manageable diseases, and the types of screenings performed at preventative exams. Did you know that 7 out of 10 deaths among Americans are from preventable diseases? This is why preventative exams are important, because they can catch disease early on and prevent its complications. They can even prevent disease through patient education. According to the CDC, healthcare should be woven into all aspects of everyday life. This includes work, school, church, government, healthcare institutions, and even community events. Some ways that preventative healthcare can be made accessible are by developing healthcare classes and giving free screenings. People can ask questions and learn about manageable and preventable diseases like hepatitis, HIV, diabetes, obesity, and high cholesterol. They can even take dietary classes to learn how to eat to prevent diseases. Other ways to make preventative healthcare more accessible is by eliminating healthcare disparities. This can be done by hiring people from different social, economic, ethnic, and cultural backgrounds. If more organizations and programs like the Affordable Health Care Act, Board of Health, and various healthcare community centers promote preventative medicine, our nation could be a much healthier nation. When a person comes in for a preventative exam, here are some of the screenings that may take place. Almost always when you come in for a doctor's office visit, the doctor will check your blood pressure. Blood pressure is a good way to detect if a patient has heart disease, if they are at risk for a stroke or a heart attack. Doctors may also collect a urine sample. By collecting a urine sample, the doctor can check for bacteria, see if the kidneys are functioning properly, or even if there's glucose in the urine, which could be a sign of diabetes. Another test that doctors may do is the hemoglobin test. This is done by doctors taking a small sample of feces from the rectum and placing it on the card and using a developer to see if the test is positive. If the test is positive, the patient will be forwarded to a gastroenterologist to check for colorectal cancer. For the females between ages 21 and 65, they can come in and get their well woman's exam or a pap smear. This is done by taking a small sample from the cervix and sending it off to the lab to check for cervical cancer or signs of HPV. One of the most popular things that doctors would do when you come in for a preventative exam is a blood test. You can get about 3 to 5 tests done out of this small tube. Doctors may check for things like HIV, hepatitis, syphilis, kidney function, liver function, just to name a few. Also, when you come into the doctor, they may do an eye exam. If anything comes back abnormal with the eye exam, they may forward you to an ophthalmologist to do further testing. So as you can see, when you come in for a preventative exam, there are a lot of tests that can be done to let you know your overall health picture and get you started on the right path. I would like to encourage you to make an appointment for a preventative health exam today. In conclusion, if we all take part in preventative and managing illnesses, we will have a better quality of life, and this in turn will impact our society in a positive way. Thank you so much, and have a good evening.